Next, we have our panel discussion with a bunch of students in a variety of healthcare tracks. Our moderator for this session is Madison, who is a representative from Wave Learning Festival. So I'll go ahead and hand over the reins to Madison.
Yeah, thank you so much, Alexia. So, hi, my name is Madison. I'm a current high school student from California, and I'm representing Wave Learning Festival. And I'm really excited to be hearing from all of our wonderful panelists today. So, we're just going to be going over a couple of questions with an opportunity for a question and answer session at the end. So, our first question is just introductions. We can go Rohini, Shruti, Amy, and Samantha. I think that's the order on my screen. So, Rohini, would you like to start us off by introducing your name, your current school, your healthcare track, your year, and something interesting about yourself?
All right. Hi, everybody. My name is Rohini. I am a current MS1 or first year medical student at the UCLA David Geffen School of Medicine in Los Angeles, California. And I'm originally from Phoenix, Arizona. So I see a lot of you are from Arizona, so that's really cool. And then fun facts, did not come prepared with a fun fact, so I'll think about it.
Thank you so much, Rohini. I think Shruti is next. I'm not sure if this is just me, but I think there's a slight audio problem. Okay, I think we might want to skip towards Amy and then Sammy, and then we'll come back to Shruti.
Okay, hello. So nice to be here with you guys today. My name is Amy. I use the pronouns she, hers. I am currently a junior at the University of Pennsylvania on the nursing track, and then also with a minor in global health. And then a fun fact about me, I don't know if this is because I'm from California, but I'm like very passionate about boba to like the point where I have a tier system in what places to go to, and I will and have fought about it to defend the tier. So yeah, that's about me. Yeah, California.
All right, I think that brings us to Sammy.
Okay, hi.
Can you hear me now,
Sammy.
by any chance? Good, okay. My name is Shruti Gajbhiye. I am a D1 at the University at Buffalo School of Dental Medicine. And sorry, give me 1 second. My monitor is acting up. Okay. And I went to high school in a suburb of Dallas, Texas. I went to undergrad at the University of Washington. And like I said, year one, so I'll be graduating in 2024. And something fun about myself, I worked in a museum during my gap year. And I worked with a lot of kids, I worked with fossils, and it was a lot of fun.
Yeah, thank you so much, Shruti. I think that brings us to Sammy.
Hi guys, I'm Sammy. I am a senior at the University of Pennsylvania. And fun fact, I actually know Amy because we're both a part of like the collegiate EMS squad at Penn. So it's cool to see her. And I went to high school, probably no one knows it, in a suburb in Delaware. And I am pre-med. And something interesting about myself, this is sort of cliche, but I actually have a very unhealthy caffeine addiction. And yeah, it's been that way for like 5 years now. And I think my friends are a little concerned about me.
Yeah, thank you guys so much for introducing yourself. I think we can go the same order. So going back to Rohini, our next question is, the theme for the 2021 National Pre-Health Conference is Unity in Healthcare. So when you think of the phrase unity in healthcare, what comes to mind?
I think that one thing that comes to mind is that healthcare, as you can see by the panel, is very diverse in what each member of the care team brings. And there's things that like my other colleagues on the call know that I will probably never know or be specialized in, and vice versa. And I think that that's what makes healthcare really special, is that we're able to serve our patients by bringing our own skill sets and working together and collaborating to give the best possible care we can.
Thank you so much. I know our order was a little bit mixed up last time, but I guess for a purpose of clarity, we can go Amy, Shruti, and then Samantha.
Yeah, so I think the first word that comes to mind for me is multidisciplinary, and that kind of goes hand in hand with what Rohini said, and it's what I've learned a lot about in my nursing student career, is that like healthcare really is a team sport, and that you have all these different people with all these different backgrounds coming in, and there are some things that nursing students know that med students don't know, and vice versa, but then we all put our knowledge collectively together for the purpose of higher quality healthcare. I feel like there's a lot of misconception and stereotype that makes it easy to create almost a hierarchy in that system of all these different careers, but everybody really is on the same playing field, and everybody is really invaluable to patient care, and that's really important to remember.
I guess that I'm next. For me, unity in healthcare has a lot to do with the diversity I see in my own colleagues in my school and even in this panel. It has a lot to do with people coming from different backgrounds and having different experiences, and combining this knowledge in order to treat a general public that is in need of care. That's something that I have seen over and over, like amongst people from many different disciplines within the healthcare industry itself, and I hope to see it grow even stronger in the coming decades.
Yeah, I think echoing what everyone has said, I think in order to sort of create a culture of unity and one that is so cohesive and celebrates everyone's strengths as a healthcare professional, I think it's of utmost importance that like we as a healthcare team, as individuals, like prioritize, being cognizant of like our own, not necessarily shortcomings, but like our own limitations, and use that to drive us, and as a way to like prioritize how we improve individually, but also how we improve in calling upon our team members in, diverting to someone else's expertise and knowledge in difficult situations.
Yeah, thank you guys all so much. Those are great answers. And that brings us to our next question, which is, have you had any experiences in high school or undergrad that inspired you to choose a healthcare track?
I would say that for me, it was very much a longitudinal, nonlinear process that made me want to go into healthcare. In high school, I had done a summer volunteering program at my local hospital. I did it, I think, 2 years in a row. So first year I was in the post anesthesia care unit, or the PACU. So people who have just gone through surgery, and getting them like food and water and just talking to them. And then the next year I was volunteering in outpatient services. So people who are coming for outpatient lab visits or care. And I think that was like one of the first moments that I had actually stepped foot in a hospital and got to do something from a volunteer and from a like serving perspective. And it was really insightful to me, and made me realize that I wanted to do more things like that. And as I did more things, like I started shadowing, I did some research. I think that it reaffirmed to me that there wasn't anything else that I could see myself wanting to do. And so I think that like the culmination of all those little things built up and made me want to go into healthcare.
So for me personally, back in high school, I think I was always interested in sciences. Like bio was my favorite class ever. So my mind was always geared towards healthcare. I think it was just a matter of what specific track to take. I did a lot of volunteer work. So I taught like hands-on CPR classes, I taught first aid classes, and then I was a staff member at this youth leadership camp, and I loved being able to create those genuine connections with people and to develop those relationships over time where I'm able to gain their respect and their trust and like almost, I guess, leave a positive impact on them even though it sounds really cliche. So I really wanted to continue building those relationships with patients as a nurse. And I think something that's really important as well is that my perception of nursing when I was a freshman is very different from my perception now as a junior. After all these years, I'm constantly learning more and more about what it means to be a nurse and all the different opportunities there are. And I know I still have a long way to go. I think what really solidified that this is the right track for me is my clinical rotation. So part of the curriculum for nursing that makes it so unique is that you do start to go to the hospital and work with patients directly in your sophomore and junior year. And that was so exciting for me to actually be there with the patients. And again, like developing those relationships with patients over time, that was what made me realize this is the right path for me.
Okay, for full clarity, I never thought I would be in dentistry. I don't think a lot of dentists think that they're going into dentistry starting from high school. I actually started high school and finished high school with the intention of doing engineering. I was going in between bioengineering and electrical for a couple of years. And I didn't actually decide on dentistry until my junior year of college when I was being pushed towards doing pre-med as well as engineering, and I discovered that it wasn't for me. It was only after shadowing and having a lot of discussions with people in multiple professions in healthcare that I came to the realization that dentistry is what I wanted to do. And a lot of it had to do with the fact that despite having a lot of understanding of engineering principles, I was missing a connection with the people's problems that I was trying to solve. And with dentistry, it's very hands-on and you're directly talking to a patient. You're solving their problems while they're in front of you. And that was lacking when I was doing engineering. And so after doing quite a bit of shadowing and spending some time around dentists and really trying to understand their profession, I decided to completely switch tracks, go into biochemistry for my major, and got lucky. I still graduated in 4 years, but it really made me just realize that it's not a linear path for most people in the healthcare profession. And a lot of my colleagues from my own school felt the same way. They didn't have a linear progress. A lot of them graduated with majors in law or business or engineering, just like me, or originally started out like me and then switched.
Yeah, I would start out by saying like I've had so many doubts along the way, which I think is a healthy attitude to have as a pre-med because, you know, like I haven't been in medical school. I like Rohini, I haven't been, you know, a resident or anything like that. So I think it's really good to, you know, have a wide open mind and consider other paths if you are pre-med. And so for me, that specifically looked like, you know, in high school, actually since middle school, I've been volunteering with Special Olympics and I have some, you know, some of the best friends I've made in my life are connected to that community. And so I just feel really, really strongly about bettering care for a population of individuals with intellectual disabilities. But I know there's tons of ways to do that that are not just, you know, becoming a physician, but through college and through my clinical experiences oriented around this patient population, and also like many conversations with physician scientists and physicians who are also, you know, doing public health research and work and focus on medical education. I've come to realize that this really is what would suit me best because I love having a balance of all those things. But my biggest priority is being able to connect with patients one-on-one, which is what I've sort of learned from being an EMT and, and from helping people out in terms of learning more about how to grow clinically, even just on that small scale of like the EMS side of things. So yeah, that's what sort of solidified my choice, but it's definitely has not been, a one moment decision.
Yeah, thank you so much again to all the panelists. I love how everyone had a slightly different path into medicine. And moving on to our next question, I think a couple of you already touched on this, but if you could redo your high school or undergrad career, what would you do differently?
I think that I'm the type of person that doesn't like to have regrets in general. So I don't know that I would specifically redo anything, but I think that in high school, you don't have to have it all figured out. And in college, you don't have to have it all figured out. So I think that we all put a lot of pressure on ourselves, especially if you compare yourself to other people who everybody seems like they know what they're doing, but in reality, like even in medical school, nobody really knows what they're doing. So I think just do the things that you love. That way you won't have any regrets. For me, that was completely my attitude in college, that, you have a checklist, unfortunately, of you have to volunteer, you have to shadow, you kind of have to do these things to the last panelist said, like, that you have to show that you want to go into this field, right? But you have choice in what you volunteer in or what type of research you do. And so if you're very intentional about picking things that matter to you and you're doing them because you have some sort of personal stake or you're passionate about it for a specific reason, you'll really enjoy your time doing it a lot more than if you're just doing something because everybody else is doing it or it feels like you need to be doing this. I think that there's a lot of ways that you can be creative about, getting the things that you need to do done, but doing it in a way that is right for you and that makes you happy and feel like, something that like further reaffirms that you want to do this, or also even trying things to test out, like, is this the right career for me? Because having doubt is definitely healthy, as Sammy said.
Yeah, I definitely am going to have to agree with Rohini. First off, I'm also somebody who kind of just looks at, even if there was like a mistake I made in the past, I want to take it as an opportunity to learn and grow. So I wouldn't necessarily say there's anything concrete I would have to change. I guess if there's one thing, it's just that I'm somebody who's very goal driven and I like to have everything well planned out. So I know exactly what steps to take to achieve that goal. So when I first came to college, I thought I'd be like someone who would work in the ER. I thought I had all these different plans of like the steps I was going to take and like what specific clubs I would join. I did all of my research and I had like a very narrow mindset of like the path I was going to go down. I very quickly realized that's not really how it works. I think something that can be harmful in that is I didn't allow myself to see all the different other opportunities there were. And then I quickly realized ER nursing is not for me. And then I felt like that moment of panic where I thought like, oh my gosh, this huge plan I had for myself is suddenly not working. And then I almost had a crisis about, is nursing not right for me then? Because this plan that I had just didn't work out. And I just realized like nursing has so many different other opportunities out there. And then I started realizing it's just about taking hold of those opportunities and learning as much as possible from everything around me. So I think definitely trying to carry that idea on of, even if you don't like, just doing the things that interest you and trying to keep an open mind about whatever there is all around you to offer. And even if you realize it's something that you don't like, that's okay. You just know that that's not a path that you want to go down, but there are 100,000 other paths that you can take as well. So just keeping an open mind.
I guess I'm going to disagree with my two previous panelists, the ones before me, just because I think I have a very different personality than them. And my experiences did give me some regrets and things that I would redo. The biggest thing for me is asking for help in undergrad when I needed it. I find I was very headstrong and I didn't really want to take help, whether it was from professors or TAs or even my fellow classmates. I wanted to do it all myself. And the university I went to, that is very difficult to handle all by yourself. And the reason is that because schools across the country have a different grading system, it is very difficult to compare yourselves across the board. But I went to a school where the average GPA for almost all my classes was a 2.7 in every class. Now, that's really harsh because my school is also known for creating a lot of students who go to graduate programs in health or just graduate school in general. And so I think reaching out for help when I needed it would have definitely not only helped my GPA, it would have helped the balance I had in my life and my mental health. And I think that's something that no one really talks about when you're going to college, especially if you're going to do pre-med or some sort of pre-health background. And I think being considerate of yourself and your mental health and the balance that you take on is really important. On top of that, I was being forced from external pressures to go into engineering or areas that I personally was not interested in. I had the classes that made me the most happy were definitely bio classes and public health classes, which I'm still interested in to this day. So had I had the guts to do it at the beginning, I would have completely switched to doing like a double major in informatics and public health, because even if you don't choose to go to medical school or dental school or nursing, it gives you a great background to work in the health field in the future, especially because there's a lot of research being done with a heavy background in computer science and health informatics. And I think that's going to become really relevant, especially in the next 5 to 10 years. So yeah, disagree a little. I had a lot of regrets. There would be things that I would redo, but I am also a student of family members who did not go to undergrad here. So a lot of it was figuring it out all by my own.
Yeah, I think I agree a little bit with what everyone has said so far. I would say I think I tend more on the side of thinking about regret a little too much. I have definitely, and I don't know what stage all of you guys are here, like everyone tuning in, like in terms of their journeys, but I came into college, like sort of like Amy was saying, with these big goals and plans for myself, took on a lot of things, took on a lot of work study jobs, took on just too much for me to handle in my first semester. And I think that I have, I think lamented on that a bit too much over the years, trying to, work back from that. Because it really frustrated me that I saw people around me, doing sort of a lot better in terms of adapting to like the environment here at Penn. And so I think I would have, been a little bit kinder to myself in the beginning and allowed myself to try and spend more time just on maybe, my classes and maybe like one work study job. Versus trying to take on, learning how to do research and teaching in a public high school and being in clubs all in my first semester, because I think it just set me up to be in a place where I had to work really, really hard to catch up for a while. And while I think that was, it's helped me become who I am today, I think it would have saved me a lot of stress if I had just been a little bit kinder to myself from the beginning.
Yeah, thank you guys all so much for such thoughtful answers. And I really want to raise again, like Shruti's point about asking for help and Samantha's point about like not overextending yourself. I think that's so important to consider. And that kind of brings us into our next question, which is, what advice would you give to current high school students debating what healthcare track to pursue?
I think that the best way to figure it out is really to just get into healthcare settings where they're multidisciplinary. So you have options where you could theoretically volunteer just at a doctor's office or just at a dentist office, etc. But there are lots of opportunities like hospital settings or student-run free clinics where you get to be exposed to the whole healthcare team and you get to see how all of them work and kind of what they do. And for me, I volunteered at a student-run free clinic where there were, I think, like 15 different healthcare disciplines, which includes all of the ones that everyone here is from. So I got to have very early exposure in college as to kind of what fields there were, and I had heard about a lot that I had never heard of before. And I got to see what they exactly did for the patient. And that was something that was really cool to me because I got to see what the students were doing and then what the providers were doing. So it was a really nice mentorship opportunity too, to be able to talk to people and ask them like, how did they like their program and what they're studying in it? And then for the providers, you know, what is their day-to-day like? And having those conversations is really great because I think when you shadow, you get one person's perspective as to what their career looks like. And that's really great. And you're able to really like get a deep dive into what that looks like. But I think that when you're working in a setting like a free clinic or a hospital where there's so many members of the care team, you're really able to see what everybody's doing. So I would definitely recommend doing that.
I think my advice is something that nobody wants to hear, but it's just based on my personal experiences and what I've heard from a lot of my friends. But just take the experiences that you have to make a decision and just go with it. And it's completely okay if like a year in or 2 years in, you realize like, that's not what I want to do. And it's okay to change and it's okay to backtrack. It's okay to like take a step back and realize like, I don't want this. Let me try to go somewhere else. Like I know accelerated nursing programs exist because people will start on the pre-med track and realize that they don't actually want to be a doctor. And then they decide to go into nursing after they graduate from undergrad. I know people who started in nursing and then they decided they actually want to try going to med school. So after they graduate from their BSN with their BSN, they start applying to med school. I have friends who started thinking they wanted to go to dental school and then switched into the pre-med track. I have people who started on the pre-med track and now want to apply for dental school. Like it's all over the place. There's no one right answer and there's no one right path and how you get to that final destination. I think it's also really important to understand, like, even though I might start as like a nursing student, if I were to potentially want to be a doctor in the future, all the experiences I had as a nursing student are still relevant and they still help me to grow as a person and learn so much about healthcare. They don't all of a sudden become obsolete and useless, and I can utilize them in the future with my future career if I choose to. So don't feel like you have to have like the right path decided, because you never know what you're going to encounter, you never know what you're going to learn, and you never know where you're going to end up in the end.
For me, my advice would be to sort out your priorities and think about your preferences very strongly when you're experiencing these healthcare settings. For example, if you do not like the idea of looking into someone's mouth, don't do dentistry, you know? And it goes along the line that you can have so many different experiences depending on where you're at. Your experience in a clinical setting can be very different from an emergency room setting. And take every experience you have with a grain of salt. For example, if you want to look into a more interdisciplinary form of dentistry, you can volunteer at the AT Still Dental Clinic. I know they have an emergency, and you'll be able to see a possibly a more medical side of dentistry. Well, dentistry is all medical, but what I mean by that is like a more surgery based. Or if you're into nursing, you could see a form of ER medicine that would be often dealing with children's care. So there's children's clinics that nurses actually are very, very prominent in for dentistry. Because of that, I would say that if you're not sure, don't be afraid to volunteer and go out and be assertive about getting these experiences, because you don't want to be down the line and having to switch when it's late and you'd have to take more time. Is there anything wrong with that? Absolutely not. I myself switched. So I'm saying that from a place of experience, that you want to get these experiences early without burdening yourself. Make sure you do this when you have time during the semester or during a summer, when you can truly internalize all of these experiences. Another great way that the pandemic has actually affected this in a positive manner is that there are some seminars and Instagram lives that occur that kind of do an introduction to each healthcare profession. You can follow a dentist on their day and they talk about their cases, or you can follow a surgeon or a nurse. And I think that's another way to get experiences without really putting a burden on yourself early on.
Yeah, I would say the question that I typically ask myself is, you know, when I was considering like, oh, is applying to medical school is going down that road the right thing for me? You know, obviously like taking into account all the experiences and sort of like exposure that you've had, but I think it's also a bit of like, okay, what have I noticed that I'm like the happiest doing over time? And how do I feel like after I come out of a clinical experience? How do I feel after I come out of a teaching experience? These sorts of things that I've sort of like had exposure to. And also sort of Rohini brought up that point about not wanting to live with regrets for me. After I had sort of had exposure to everything and was not everything, of course, but after I had sort of considered more, I realized, you know, if 20 years from now I was in a different career, I would still want to like say I couldn't do medical school, I didn't get in, something like that. 20 years from now, I think that I would still want to try and become a physician. So that's what helped me make my choice.
Yeah, thank you guys all so much. And I think we're at about the halfway point for prepared questions. So thank you, Rohini, for always answering first. And thank you, Sammy, for being so patient till the end. I think we're going to switch up the order and we're going to go Sammy, Shruti, Amy, and then Rohini. Starting with our next question, which is, what is an important aspect of deciding to pursue a career in healthcare that might get often overlooked?
Oh, yeah. Important to consider. Often overlooked. I think it's just sort of a continuation of what I said last. I think consideration of what your priorities are outside of medicine. It's sometimes talked about, but not talked about enough. Yeah, definitely considering what else is really important in your life that has no connection to medicine and your career, and figuring out a way to work that in as early as possible. So for me, that was figure skating and pursuing art in some way. I started out college not doing that anymore because I had quit for a while due to an injury. I realized during college and trying to do all these pre-med courses and everything and clinical things that I was not at my best when I wasn't pursuing that thing that I really also loved outside of academics and in clinical experiences. So once I started incorporating that back into my life, luckily I had the opportunity to do that. I started noticing a real change in my motivation and my drive to show up for people, to try to start excelling more in school. So I think that is a really big thing to consider. It's not really a yes or no question. It's more of how are you going to fit your priorities in and make sure they're still your priorities when you're pursuing a career in medicine.
Yeah, thank you so much. I think that brings us to Shruti.
So I think it's really easy to be to think that these healthcare workers, they have a great life, they have a nice pay, they have the ability to get everything they want out of a future career. And that's not necessarily true. And we started seeing a lot of that during the pandemic. The truth is that your undergrad experience will not be as hard as your graduate school or professional school experience. It won't even light a candle to how hard it is. It's a lot of long hours, a lot of forgetting to spend time on yourself and prioritizing yourself. And if you don't go in with the mindset and knowing that you can lose what you find important, I think it's very easy to get burned out. And even if you do remember and you try to take time for yourself, it's still possible to get burned out. Most of my classes burned out. We've had 2 to 3 exams a week for the last 7 weeks. We have practicals. I'm in my clinical gear because after this, I'm going to run and go work on my preparations for practicals. It's easy to glamorize these jobs, but in reality, it is something that you have to truly love to take everything in a positive light. You really have to love the patient experience. You have to love the information you're learning. It's not something that comes easy. And I find that's very often overlooked.
Thank you so much. And that's such a meaningful point to bring up. So thank you again. And I think that brings us to Amy next.
Yeah, I feel like this should be something that's really obvious, but I still see it happening. Like, don't go into healthcare because it pays well. Like, if that's your ultimate goal, just don't do it. It's not worth it at all. Like, just how much else you have to put in. Like, the money is the least of my concerns at this point. It's about like, it's so much more about like the actual patient care. That's what matters to me. I feel like for me, something that I personally overlooked is how important drawing that barrier, or drawing, not the barrier, but like drawing a line between balancing your empathy for your patients, but also like a professional relationship and distancing your own feelings. So like as a healthcare professional, you're working with a lot of people and not all of the outcomes are positive. I personally have a lot of experience with working with oncology patients, and I get a lot of patients that don't necessarily have like the happy outcomes. Some of them don't survive. And on one hand, I have to have empathy for them, and I have to be able to really see them as people and understand them, because that is so important. I've always been told by my instructors that the day that I lose empathy for my patients is the day I need to stop doing nursing. And I wholeheartedly agree with that. But at the same time, like, you cannot let those feelings get so personal that you start taking on that patient baggage. And that's what leads to so much burnout within so many different healthcare professionals. So really learning to draw that line between learning to empathize for your patients, but also forming that healthy barrier to protect yourself and prioritize yourself as well.
I would say I agree with everything that everyone has said so far. And one thing that I had recently heard a classmate say to describe like how medical school has been for us is we're all just juggling balls, and most people aren't that great at juggling. So you have to be okay with at least some of those dropping. And if you just imagine that those balls are like your work, your family commitments, like all of these things, I guess you have to prioritize which ball you're going to make sure that you catch and which one that you're going to be okay with when it drops. And I think that does really summarize so far what like medical school has been like for me. And even undergrad was like this in a way, that there's so many things that we have to do to keep on track, and it's impossible to do everything. And it's important that we are okay with that and we recognize that it's impossible to do everything. And I would say that for you all who are high school students and maybe some college students, that you think about what well-being means to you. And you know, everybody gets stressed, right? And so making sure that you have a good toolkit for when you do get stressed. How are you taking care of yourself? What are you doing? Because if you can practice that early on, that's like the most important thing that I think that you can take with you as you advance in your studies and as you like advance towards your career, right, is you can take all of these classes to prepare you for the next step. You can shadow, you can do all of these things. But I think like the most important thing is making sure that you know how to take care of yourself. And I think that if you do that, you'll be set for whatever you end up wanting to do.
Yeah, thank you guys. That's such an amazing point to make. And thank you all for being so open about like, realities and real stresses that come in healthcare. And kind of on the flip side of that, our next question is, what has been your favorite part of undergrad or graduate school? I think that brings us to Sammy.
My favorite part of undergrad. Okay, I think I have sort of a two-part answer for this one. One is I think just like my favorite sort of theme is that I've become a lot more comfortable with the idea of the unknown, and just sort of the idea of not being in control, of everything. In terms of like what I'm going to do, where I'm going to end up, all these types of things, letting go of that a bit and more trying to like be in the moment. So that's sort of the theme that I've noticed change a bit. And then just in terms of like favorite part of undergrad, I think for me, I had the incredible like opportunity to start our like competitive figure skating team. And so I think that being able to travel to sort of random, college towns across the East Coast with people who, a lot of whom had never had that chance to compete before, I think that was my favorite part, because I got to see people, who had wanted to compete in figure skating since they were little, but had never had, the chance to do that and be able to. And so I think that was really, really memorable to form a team and see goals come to fruition for people for the first time.
In undergrad, for me, one of my favorite things was my support system that I had built. Was very fortunate to have amazing friends, and friends who were all pretty much in the same community and we're all involved in each other's events. So even if I had to do something for a club or I had something that I had to absolutely participate in, it was still fun. It was something that I still smile at when I think about today. And I took those experiences and kind of turned them into a learning point that whatever you do, even though you are removing yourself from school, you're not learning the material itself, you need to enjoy it. You need to do stuff outside of undergrad or graduate school that you really enjoy. For grad school, you know that feeling of when you close all your tabs after a really rough exam? Yeah. For me, I have that feeling once a week in dental school, at least once a week, because there's always going to be something coming up, whether it's another exam or a practical, or I have to have an inpatient experience that I don't feel like I'm personally ready for. That feeling of relief and getting through it and realizing, hey, I really learned something today and I'm going to remember that. And it's really different in grad school in comparison to undergrad, because you're learning stuff in undergrad that you don't find relevant to your life and to your future. But in graduate school, you wake up and every day you're going to learn something new, whether you don't think you will or you're expecting to. And it's never the technical skills that you walk away with. It's those patient interactions and how you want to further yourself as a physician and healthcare professional that I have personally enjoyed the most. I get that feeling of closing all my tabs weekly because I am really fortunate to have such a strong interest in oral health and public health and with physician-patient relationships that my experience and what I enjoy is drastically different from what I had in undergrad, but it'll obviously differ from person to person.
I have two answers. So my first would be my clinicals. I think it really is a privilege as an undergraduate nursing student to already be in clinical settings within the hospital, at community sites, working directly with patients. They are, even though the days are long, they are absolutely amazing. And I always leave feeling so satisfied with how the day went and being so happy with the experiences that I get. And I would say the second, nursing classes tend to be very small. So my cohort is a little bit over 100 people total, and we all take the exact same classes, the exact same professors at the exact same time. It's like the nursing curriculum is very, very strict on when you take classes. But I think because of that, because we're always constantly in the same classes together, we see the same people, it's so easy to build a community together. And we always have all these inside jokes about the different professors and the different classes. And it's something that you wouldn't really understand unless you're directly in the nursing class. So I'm glad to have all these people with me that almost get the things that I'm going through because they're going through it with me at the same time. So even if things get stressful, like I know, like, oh, at least we're all in this together.
One thing that I really enjoyed is my partner, who I started dating in high school, and then we went to college as well. And it was really nice to be able to do a lot of the things, like volunteering and like shadowing. We did a lot of that together. So when I think back on college, I just think back about how we had the opportunity to, go through this challenging time and like difficult process together, because neither of us really knew what the process for like applying to medical school one day really entailed, but we were able to, figure it out together and help each other along the way. And I think that just having somebody there who get what you're going through is really helpful, because when you're stressed and just want to take a day off, it's helpful for someone to be able to empathize and be able to be like, yeah, I totally get why like you don't want to text back or you don't want to call, or that, or to have somebody be able to like really appreciate what makes you happy, because there are things that, in the healthcare world that only like we understand about each other, so I think that is really helpful. And so if you can make a friend or a group of friends, like how Amy had said, like her whole class, like they all get each other. But if you can have people that, really get what you're going through as you're going through it, it'll make the process so much more bearable.
Yeah, thank you guys so much. I think that brings us to our second to last prepared question, but could you walk us through a day in your life and just tell us what your daily schedule looks like?
Oh man. I feel like it changes in an undergrad, it changes semester to semester for me. But if I could describe a day in my life, I guess right now, or just a general semester, I guess like components of my week, typically class, of course, but usually my day is some combination of like class, either going in person to see people in my lab. We're doing like remote stuff for lab, whether that's like calling participants on the phone to do some type of like psychiatric and clinical interview, or just doing some like data work. Obviously spending time studying. I'm really lucky that I've finished most of my pre-med requirements now, so a little bit less on the exams this semester, which is, I'm very grateful for that. But then I typically have like a couple hours per week that I do things with Special Olympics, and then also for figure skating. I spend a couple hours on the weekends coaching figure skating now. And then something that does take up a good chunk of my time is being on shift as an EMT, because with COVID, and I think this ties into the next point, but with COVID, we're sometimes short-staffed, and so filling in for people and making sure that younger EMTs like have the skills they need has been, I think, a good bit of my time this year.
So COVID has changed the schedule of dental school. Normally you go to school at 8 in the morning and you don't leave until 4 or 5 p.m. But because we're really fortunate, my school has split it up to where all lecture heavy courses that don't have an in-person component are taught online, and then all the other labs and clinical parts are in person. So even though I may be home, I'm still like the rest of you have been in high school. I'm still usually busy from about 8 a.m. to around 3 to anywhere from 3 to 5 p.m. And then we have lab hours or extra lab hours where you go in, get your hand skills, drill, do some restorations. And what I mean by that is like you practice filling cavities, you practice root canals, you practice all of this stuff on mannequins because I'm only first year. I'm not doing this on patients yet. And the thing is about dental school, it changes also from year to year. So if you ask me, I am in a lot more lecture heavy courses than a fourth year would be, who would be pretty much treating all patients. On weekends, I also have extra lab hours where we have to go in and practice our hand skills again. There's a lot of that in dental school since it's not just, it differs from medical school because we have to be competent by the time we graduate. So we have to be practicing physicians by the time we graduate. Residency is not required. And so you get board certified by the time you leave. And because of that, there's a lot of like extra hours and stuff so you can get practice and feel comfortable by the time you start treating patients in anywhere from second year to fourth year. Outside of these hours of school, I think there's just a lot of studying across the board. It doesn't matter which health profession you're in, there's going to be a whole lot of studying when you're not in class. But it goes by fast. I will say that when you are with your classmates and your cohort, you learn to enjoy being busy. And I know that sounds weird. I understand that's not necessarily an easy concept to understand, but you learn to enjoy being busy. You learn to like learning a lot. And I think that's something that will carry me through the next couple of years.
So my schedule also varies a lot depending on the day. So I have clinicals on Tuesdays and Thursdays. Actually, a few weeks ago, I recently just switched rotations. I was working on a psych rotation up until a few weeks ago. So I was getting up very early in the morning and going to my site. Now I don't get up in the mornings. I have an afternoon rotation, but I do get back home very late at night. So that usually takes up my entire Tuesday and Thursday just because they're so exhausting. And then on the other days, I usually, all my mornings are filled with classes. Nursing classes tend to be very early in the morning, which is not great because I'm not a morning person, but just got to deal with it. And then I also do have a work study position at a nonprofit that I love. So that's usually what I'm working on in the afternoons. And then just a lot of studying at night. Like Shruti said, I don't think it ever ends. I think I always have something to study for and to work on. Towards the weekends, I recently took on a coding class because I thought it'd be fun. I'm not sure how I feel about that decision, but I usually spend all my weekend trying to catch up on coding, and it's a little bit painful, but still fun. And then, like Sammy mentioned, I'm also part of our EMT group on campus. So I do a lot of overnight shifts just because I don't have the time to do the day shifts, but they're really fun. I get to help work with the younger EMTs on completing their skills, and then we just sit and chat together and then respond to calls. Yeah, so a lot of meetings for extracurriculars, and then all my free time usually goes towards studying. I definitely agree with what Shruti said. You do have to just learn to like being busy. It's gotten to the point where if I have like a free night, I think it's just so off and I'm not sure what to do to like relax. I usually just end up going to sleep. But yeah, I do enjoy being busy. And I do know that the things that keep me busy are things that I love doing. So that definitely increases my motivation and my productivity.
If I lag at all, just let me know because I think I'm lagging a little bit. All right. So my schedule varies by the day, and it also varies based off of what block we're in. So in college, you have semesters or trimesters. In high school, I had trimesters. Med school is a little different in the sense that or at least my school, and I think a lot of medical schools do it this way, we split our curriculum up based off of what organ system we're talking about. So for example, right now we're talking about the musculoskeletal system, so bones, muscles, tendons, that sort of stuff. And we have 5 weeks in which we're covering everything about all of that. And so the way that it works is we don't have classes in the way that you have classes in high school, like there's no biology class, chemistry class, etc. And same in college. In college, you pick what classes you want to take. For us, everybody takes the same classes. They're all kind of different. They're all taught by different professors or doctors who might have a specific specialty in whatever that class is. And so every class is kind of different. So we might have in a typical week what drugs that you might use to teach or to treat arthritis, for example, and that might be a whole lecture. This past week, we had 2 lectures all about non-steroidal anti-inflammatory drugs. So think like ibuprofen. We had whole lectures on just what opioids are. So it's interesting in that sense that I think I like it better than college in the sense that I'm taking classes on things that will directly impact my career, whereas in college it can kind of feel like sometimes you're going through motions with some of your classes. And then as for our schedule, it depends on the day, but 3 times a week this block we have 8 a.m. classes, and it can go anywhere from 8 to 5:15 or so. It really depends on the day. They always make sure to give us a lunch break between 12 to 1. Some days of the week, we have our afternoons off so that we can study. And in the free time that we do have, usually that's when we'll do our elective classes or do our volunteering, and then of course our studying.
Thank you so much to all the panelists for your responses. I think we're going to open up the floor to a Q&A session now. So if anyone has a question, you can either message it to me and I'll read it out loud, or you can just raise your hand and ask your question out loud. Okay, I think I just got a question in the chat, and this one is, I guess anyone can jump in, so don't worry about speaker order, but what is your strategy for learning extensive material in a very short amount of time?
I know this is really popular amongst healthcare professional schools, but Anki, it's like a flashcard deck that's online, and it works with repetitive recall. And I think that's really helpful. Obviously, paying attention in class makes a huge difference because these professors, most of them in these schools really, really care about you. Rohini, I see that link. And honestly, I would get used to it in undergrad if you intend to go to these into like nursing or medical or dentistry. I would get used to using that because even if you don't end up going to a healthcare profession school, it's really good for classes that you have to memorize a lot of facts for very, very quickly. It doesn't really help for math. It doesn't help for physics. For example, I tried using it when we were doing some sort of fluid dynamics and fluid mechanics in one of my classes. Didn't work out, but it really depends on the material. And you also have to consider your strengths. You have to consider if you are better at math or you're better at memorizing facts, and you have to give enough time accordingly. You get really good at estimating how much time you really need to know something. And I don't know if anyone watches Med School Insiders, but there's like this really popular theory that the owner perpetuates, and it's the task takes as much time as the spot you have to fill it. So if you give a lot of time to this, it will naturally fill up the amount of time you have allotted to it. But when everything is really go, go, go in medical school or nursing or in dentistry, your mind adjusts. If you start using flashcards, if you pay attention in classes, things naturally just get better.
Thank you so much. Oh, sorry, go ahead. I think we have a couple other study tips, so I'll hand it over to Amy.
Sorry for interrupting you. But I have two answers. The first, I like to have things physically in front of me. So I do know that Anki exists, but I'm still old fashioned. I use like actual physical paper flashcards just because I like to hold them in my hand and like turn them around. And then I have like pieces of paper, like scratch paper and notebooks that I'll draw diagrams on, or I'll physically write things out. I tend to be able to absorb information better that way, even if it's a little bit more tiring or it feels a little bit more tedious. And then I know that I have learned something well if I'm able to teach it to somebody else. That's like a great way to, if like you're able to coherently tell all the information you learned to somebody in a way that they understand it, then you're at a good place. So I'm lucky that two of my roommates are actually also nursing students. So like if we're studying for something together, and then I'm able to say like, all right, I'm going to teach you about how kidneys work now. And I go through everything and they're like, all right, that makes sense. And I know like, okay, I'm at a good spot. And then now like on the exam, I'm able to like go through everything that I just taught my friends. And then like, that's how I'm able to ace exams essentially, or be successful on exams. So yeah, being able to teach others and then just physically writing things out, even if it takes a little bit more time.
Yeah, I definitely agree. I'm definitely a big Anki fan too. I think for me, something that I don't do enough is utilize like kinesthetic learning. So I think it's a little underrated, like similar to what Amy's saying in terms of teaching. I think some of my best learning has come from like recording myself, as weird as it sounds, recording myself, like summarizing concepts, having that as an audio recording on my phone, and then like going off and either like going on a run, a walk, or a bike ride and just listening to myself explain things. That sounds super weird, but it is really helpful, gets you out of the house, and makes you still feel like you're doing work, even if you're trying to take a break when you're really pressed for time.
And then I would say all those tips are really great. I am an Anki fan now, but in college, I definitely didn't use it. I think that it's good because, you know, in grad school, professional school, there's just so much content that we have to know that it really is helpful. But I think in undergrad and in high school, it's definitely possible to chill and not have to do a bunch of flashcards every day. So I would say one thing that's really helpful is talking to people who have taken the class that you're in before you. So if someone took it last year, asking them what they did to study and what was helpful, just because every teacher and professor is going to teach differently and assess differently. So just being able to know what is actually helpful is good. And then the other thing I would say is there are different learning methods that will work for different classes. And so experimenting with all of those can be really helpful, because sometimes it's really helpful for me to do flashcards. And then other times it's really helpful for me to teach people or to do things. So just testing out what is best for you, and being comfortable with changing completely how you study is really.
Yeah, these are all such great tips. I'm definitely taking some notes right now. But I think we have another question in the chat from Angelica, and she's asking if there were any clubs or organizations that you were a part of in high school that sparked your interest in healthcare.
I can go first. I mentioned this already, but so I was involved with the American Red Cross, and that's where all my volunteer experience came from. And then I was certified, I think, to be like a volunteer first aid responder at some public events. So I was actually able to work at the Rose Parade on New Year's. That was really cool. And then I taught a lot of hands-only CPR classes. I taught first aid classes. And then over the summer, I would always staff at this like leadership development camp for youth. So I already love the healthcare aspect of like delivering healthcare as a first aid worker and then teaching first aid. But I also just loved being able to have those relationships with people, and like with the youth camp, getting to know somebody and then working with them over a period of time and seeing them grow with like classes, just interacting with different people and like teaching them was always really fun. So like I combine them together, and I thought the best path for me would be to try nursing. And I found a lot of ways to relate what I do in nursing back to what I enjoyed back in high school. And I think that solidified that I made a pretty good choice for myself.
I didn't really do much healthcare oriented stuff in high school. I see Rohini is the same way. I just didn't, I don't know, it didn't draw me at the time. I did have a lot of experience that I had built up over the years about with education. I spent a lot of time educating with underserved populations. And I think that actually kind of helped me transition into dentistry, because dentistry and just the healthcare profession in general has a lot to do with educating patients and connecting with patients on a closer level. And that's something that appealed to me greatly within education. So instead of actually getting healthcare experience, I got interpersonal experience. And I think that was very, very valuable for where I am today.
Yeah, I'll just say I also didn't do a ton of healthcare stuff, but that's because the challenge of being a high school student is so many of these healthcare opportunities are age restricted. And I don't remember exactly when I turned 16, but I think 16 and 18 were the ages for most places that you could actually go in and do something. And for me, I was like an age younger than my grade. And so that made it even more difficult to do anything. But I think that to Shruti's point is when you're able to do things that you're building skill sets that will help you out, that's great. Like for me, even in college, I didn't do a ton of like the traditional pre-med, pre-health experiences. Like I didn't serve as an EMT or a CNA or any of that. Instead, I did stuff like being a tour guide or doing like student government type things. But I think that when you're able to talk about how you built those leadership skills and communication skills and things like that, that can go so much further actually, to be able to say like, I have all of these skills and I know what it's like to think about this from a different angle. And that's why I want to bring that into medicine. It can really even like bolster who you are as an applicant. And I think it's also probably more interesting for admissions committees to talk about non-healthcare related things, because
Yeah, for sure. I think for me, I had like the opportunity to volunteer at a children's hospital in high school because I was an inpatient there and I found out about this volunteer program. But again, it was age restricted. I waited until I was 16, and then at that point I could also drive there. And so I remember my best friend in high school and I would alternate driving when our family's cars had availability so that we could get there. But it's not necessary. And I think I learned so much more about healthcare and how the system works and how people are affected differently through directly interacting with my community in Philadelphia, and taking the time to really dive in, ask people who I'm volunteering alongside, ask participants in our research study, like how they feel about the care that they've received and the lack of care they've received. So yeah.
Yeah, thank you so much. I think we have another question in the chat from Sukriti, and she's asking, what major did you choose for undergrad and how did that help you with your work today?
I was a double major in, so it's law, biological sciences with a concentration in biology and society, and then business with a concentration in public service and public policy. So to summarize, basically like biology and society and then public service policy. And for me, I picked intentionally wanting to do something outside of science and STEM because I knew that I wanted to do medical school and I knew I was going to get a lot of science thrown at me then. So having the biology and society degree gave me all of my like prerequisite classes. And so I was able to make sure that now in medical school, I still have the solid backgrounds and all of those that I need. But doing public service and policy was nice because I knew that that wasn't necessarily something that's integrated into the medical school curriculum. It's not something that I would have gotten to learn if I wasn't like seeking that out now. And so I think that if you have the capacity, doing things that you're just interested in and want to learn about is really great because I definitely don't have the capacity now to learn like business and all of those classes that I was able to do in college. And I think that it was really nice for me to be able to have that perspective coming into medicine now.
So I touched on this a little. I started out as engineering. I went into somewhere in between bio-e and electrical. I kept switching back and forth. I wasn't really sure. And the way my school is set up is you have to apply to get into these majors. It's not an easy switch. And eventually I realized I'm not even interested in these things. I love the classes that are more biological based. And I realized this while taking a materials engineering class that had to do with biological systems. So it took me a while, and then I switched to biochemistry with a concentration in electrical chemistry with the minor in chemistry. That helped me a lot. Thankfully, I got a lot of my prerequisites out of the way with the first year of engineering. There wasn't a lot that I had to take on extra, and I enjoyed it a lot more. I don't recommend everyone to switch around a lot. I would say take classes you're interested in. For me, it was a product of my system and my environment because I was on a quarter system, not a semester system. And from what I've talked about with my classmates, it's easier to explore your interests with a semester system. So I would definitely take some classes that you have some interest in, but don't lock yourself down into a major until you're pretty sure what you want to do.
Yeah, so I'm majoring in neuroscience and minoring in chem also, which is like pretty default, I think, for a lot of pre-meds. And then also minoring in Chinese. And so coming into college, I knew that I wanted to continue learning Chinese and take more classes in that area. I didn't know for sure if I was going to minor in it or not, but as I went along, taking those courses and taking more of the other requirements for the minor, I was like, this is amazing. And I actually took a really cool class in the nursing school, which is it was a traditional Chinese medicine seminar where, which was amazing. Not counted towards my Chinese minor and was also had the travel component. So I was able to learn about comparative healthcare systems and just learn a lot. And this was right before COVID. So it was like winter, January, COVID in the US, like January 2020. And so yeah, that's a long-winded way of saying exactly what you guys have said in terms of like pursuing your interests that you might not get as extensive of a chance to pursue in graduate school. And then I'm also sub-matriculating into the Master of Bioethics program at Penn for during my, alongside like my gap year job. So in terms of doing that, I just started signing up for grad level classes after talking to the professors about them. And I was able to participate in these really cool classes that, starting out as a freshman, I would have been like, no way I could be in a class with physicians and law students and nurses. But those types of things are usually possible if you ask and you demonstrate true interest. So yeah, I would recommend looking for other opportunities than you think are initially possible in terms of academics and undergrad.
I don't think this is really relevant to me just because there's just one nursing major, which is what I am. But yeah, definitely, even though our classes are very specific to nursing, I do think it's really important to step outside of just strictly healthcare. That's why I'm trying out this coding class. And I'm also taking a Japanese history course, which I'm really enjoying. So having that balance is really important.
One of the most interesting classes I took was a medical anthropology class about how pathogens are transmitted from primates to humans and how primates and humans have co-evolved to have this transmission of disease. And it was so outside of what I normally studied that I wish I had taken more of these classes. And it was also really relevant to dentistry because a lot of these things you can trace back in terms of oral health to primates. And it just makes me want future students to really branch out and garner these experiences that are not the norm, that are not just part of that checklist that you are required to have. You can still accomplish all of that while enjoying yourself and exploring a lot of different options.
Yeah, and then for me, an interesting class that I took, it was called the Embryo Project, and I went to Arizona State University for undergrad, and it was basically a project that our Department of Biology and Society ran, and I'm trying to think of how best to explain it, but basically it's like an encyclopedia, I guess. So basically explaining complicated science topics in reproductive health and developmental biology in encyclopedia form, meant for just like the general public. And I thought it was a really cool way to explore reproductive medicine and developmental biology while also trying to figure out how do we explain complicated topics like the HeLa cell line, if anyone's familiar with Henrietta Lacks's story, or different topics like that. How do you explain that to the general public who might not have the same science background that we do? And I think that was really cool because in medicine and in all these healthcare fields, we have to constantly explain to patients who don't have the same vocabulary that we do what's going on. And so being able to talk about complex things in simple ways is really great and a really great skill set to have.
Yeah, thank you so much, everyone, for your answers. I think we have one last question in the chat, but for all the panelists who have had experience working with patients, what is the most memorable patient experience that you've had?
Mine was during my gap year because I was also working front desk in a dental clinic. And for anyone who goes into healthcare professional fields, you will learn that insurance can be the bane of your existence. And it is something that you will constantly have to have an uphill battle with. And this poor woman needed some night guards because she was grinding really badly. It was destroying the tops of her posterior teeth, so your back teeth, your molars. And the insurance was not releasing and paying for these night guards, which she very desperately needed. So I do remember staying on the phone with them for 2 to 3 hours arguing my case, and eventually they paid for it. And this woman was so grateful. She went out and she wrote me a handwritten card and got me a gift card, which of course I could not take. It's not ethical to, but the note itself meant a lot to me, and it kind of reminded me that the entire purpose of this is to better someone else's health. And I took personal satisfaction from that experience.
I have so many, but the one that I'm thinking about, it was during a rotation on a oncology floor. I met the patient at the very beginning, and this was my first this is actually my first rotation on like a med surg unit, which I was very excited about, but I also felt like I didn't really have that much experience, so I was very nervous about. And they were so sweet to me, and I spent like 3 or 4 hours literally just in their room talking and chatting. And then because it's an oncology floor, the patients tend to stay there for a very long time. So even after that day passed and I wasn't assigned to that patient, I'd always see them like walking down the halls. Patients have to ambulate, doing those things. I would pop my head in real quick to their room and say hi. So we were always chatting, always stopping by to say hi to each other, things like that. And then I remember at one point I was helping to set up their IV, and I mentioned earlier in that day that it was my first time doing it, so I was really excited. And then he actually offered to take a picture so that I can send it to my parents. And I was like, oh my gosh, thank you so much. And then I think I was talking to my instructor while I was in their room. And then I like mentioned how I was so nervous because it was my first time on a med surg floor, and the patient actually told me like, you did such a great job. I was so happy like to spend time with you, and I think you're gonna make an amazing nurse. So I got very emotional hearing those words. And then they actually ended up getting discharged on my last day on the floor. So it almost felt like, oh, we're leaving the hospital together. So it was just like a very nice ending. And yeah, it was I think that patient definitely meant a lot to me, and it almost felt like they represented my like first experience on a med surg floor.
I haven't had a ton of patient experiences yet because I'm still in my first year, and COVID has also made it challenging to, see a lot of patients. But one of the things that we have is an early authentic clinical experience, and mine is with a hotspotters program, which essentially just means for patients who have more complex health needs, we get to see them throughout the whole like academic year and visit them. And that's been a really great learning experience for me. So I've been able to see my patient like every month throughout my first year, and we get to continue visiting her and seeing how she's doing. And what's really cool to me is she used to work in healthcare. So she has a lot of the vocabulary that I still don't. And so that you learn a lot from your patients already, but then on top of that, she knows exactly what's going on with her health. And so it's really nice to hear the patient perspective, but also a patient who's able to exactly like describe what's going on. Because for me, like as a first learning opportunity where I'm still trying to figure everything out, being able to hear how my patient is feeling is really important to me. And it's really such a great learning experience. And then it's also made me think about, when I do have patients that can't describe exactly what's going on and all the technical happenings of what's going on with them is something that they're unfamiliar with, just how much more important the role of like healthcare providers is.
I think mine, I'm torn between a lot also, but I think probably the most sort of impactful moment that I remember in terms like an emotionally, charged sort of interaction was with one of the participants that I worked really closely on. I'm in like an autism study for adults, mostly adults on the spectrum. And my participant had a really rough path towards getting her diagnosis of autism. And she had been through, a lot of co-occurring psychiatric conditions. She had been through periods of suicidal ideation, and she, had a long history of needing to be on antidepressants, and was on a journey to sort of wean off of her medication. And the big reason for that was a lot of these psychiatric difficulties that she had were really exacerbated by the lack of like connection that she felt with her interactions with the healthcare system and the delay in getting her diagnosis. And so she wasn't able to care for her daughter for years, and actually lost custody of her daughter. And so when she felt like she was getting, more comfortable, and when she had actually, gone through, a more positive period in her life after getting her autism diagnosis, and got supports and was able to work more comfortably through her job and everything. She actually was able to be sort of reunited with her daughter, and she shared this moment with me. And I just didn't expect her to feel like, after our few conversations or interactions, I didn't expect her to feel so comfortable sharing that, deep vulnerability in that moment with me. And so I just felt really privileged to get to be a part of her journey in that way.
All right, I think we're right up against the 30 minutes of the end of the event, but thank you so much to all the panelists. Like, as a high school student, I'm so inspired by all of your stories, and I really appreciate you guys taking the time to come and just share your experiences with me and all the other attendees of the event. So thank you again so much to all the panelists and to everyone who came.
Thank you so much for attending our event. Before everyone leaves, I just want to screen share again some of the announcements. You guys are high schoolers, so you're still pretty early in the game of getting ready for applying to medical school after college. So if you want to learn more about this process and also explore different careers in healthcare, if you're interested, just a reminder that the National Pre-Health Conference registration for our annual conference is open and it's free. So you guys can join our Zoom webinar over the summer and learn together about different topics with us. And yeah, thank you so much for everyone who's here. Thank you to our panelists and to Madison for leading the panelist discussion, and Alexia. And we are looking forward to seeing everyone at future NPHC events and WAVE events. Keep learning, stay curious, and feel free to reach out to any of the either Alexia or Madison or I if you guys have any questions about NPHC or WAVE. Thank you so much for coming.